Hello, my name is Julianna Posada. I am a nursing student at BCC, and I will be recording today validating how to connect my main IV line to one of my patients. So first things first, before I even walk into my patient's room, I have my doctor's order, and I will come into the room, introduce myself to the patient, tell the patient I am a nursing student, and explaining the procedure I will do today. So in this case, I will walk into Mr. Smith's room, check Mr. Smith's ID, make sure it matches the patient's order. In this case, it does match the patient's order, so I know I have the right patient. Down. Wash my hands, everything is good. Put my gloves on.
Okay, guys, you have 15 minutes. That clock is 5 minutes.
Okay. Before doing anything with my patient, I will make sure I have my 6 rights correct. And the 6 rights are: I will have the right patient, the right drug, the right dose, the right documentation, the right time, and the right route. Yes, I have everything correct. So once I come into my patient's room, I will grab the main tube or the main medication. It will be medication or saline. In this case, it's a saline. I will check the name, make sure it matches my doctor's order. I will then check the expiration date and make sure it has not expired. After I do that, I will come over here and make sure there are no cracks, no particles, anything in my main line. Everything is okay here.
I wash my hands and I put on my gloves. I check the doctor's orders and I made sure
this is sterile, so I'll make sure nothing touches this and put this on top of an alcohol swab. This is also sterile, make sure nothing touches anything. I will then spike my bag.
15 seconds.
Okay.
Before inverting my bag, I will make sure my clamp is locked and it's not moving.
Make sure that it's the
It is locked, so I will now invert my bag.
ask the patient if they're okay. Check the IV site. Make sure it's not inflamed, it's not infected, and it looks clean.
Once I do that, I will pump the chamber halfway. Okay.
Then I will begin.
You just put it in.
I will then prime my bag and make sure I have no air bubbles.
Actually, I do this
Usually right on the vial, it says, like, look, if you want 300 milligrams per milliliter, put 10. If you want 400, put 7.5. You know, it has...
Okay. No air bubbles are here. This is closed. I will then grab an alcohol swab.
Side. Again, I can't touch it now.
I will scrub the hub over here, my IV. I will then come to my patient's IV site, scrub the hub there as well.
Didn't touch anything.
Before connecting any IV, I will make sure and check that my patient's site is not swollen, it's not red, and there's no bleeding, and make sure everything is okay. If there was anything wrong with my patient's IV site, I will report that to my clinical instructor and make sure I don't connect anything here.
Take this bag off.
So I will connect the IV to my patient's IV site.
Lower it.
Okay. Connected it, and then I would work on my drip rate. In this case, I cannot leave this connected because this is a mannequin. So I will disconnect it for now.
Don't touch it, and now I can connect it.
You're backwards. You have the right protocol here.
And I will be doing the drip rate. I will do 25 drops per minute.
Air. Equal to the dose of long-acting insulin,
So then-
which is the cloudy. So you put the air in the cloudy,
So the video, I'm
then
gonna
you put the air in the regular.
Starting
flip it over,
now.
Take the regular out, then flip it back over, take it out.
I have a basin,
Put the needle in, flip it over, take it out.
like my water. It would not be this, and it would not be a dirty needle. It would be brand new. Now I open this port all the way. Actually, first I can
Air,
push the water
draw. I mean,
halfway.
yeah,
Now I
air,
flush the
air,
water, open it all the way.
draw.
And I'm controlling the drip rate with this bag's dial here.
If you do,
Now this drip rate is also 25 drips
it's pretty simple.
drops a minute.
You
So that I
just,
would calculate.
I would take a tissue.
Make
take a
sure that,
tissue, and you just
this one would be stopping while this one's
be
going.
gentle, because sometimes the whole thing is cracked. Yeah. And we give a little force, you know. I usually, when I open them, I put cloth on both sides because I would crush them sometimes by accident. Yeah.
Okay, and that was exactly 25 drops per minute. All right. And then once I do this, I would clean up my site and everything is okay. Thank you for watching.
Calculate.